Okay, good afternoon, everyone. Thanks for joining us from the Legislative Building in Regina. Today we have Dr. Shahab, Saskatchewan's Chief Medical Health Officer. Joining us on the line, we have Scott Livingstone, SHA CEO, as well as Dr. Susan Shaw, SHA's Chief Medical Officer. We'll start with an opening statement from Dr. Shahab, and then we'll have time for questions. Go ahead, Dr. Shahab.
Good afternoon. So I'll just begin with some announcements on cases and other important information for today. So unfortunately, Saskatchewan has recorded 2 new deaths related to COVID-19. These are residents from the far north, and one individual is in their 80s and another individual in their 60s. So this brings our total number of deaths in Saskatchewan to 10. Again, our deepest condolences to the family and friends of the 2 recent people who have passed away, as well as others who have been faced with COVID impacting their lives. And these obviously continue to be difficult times for people who are impacted in such a way. In addition, there are 3 new cases reported today, 1 in the far north and 2 now in Regina. So again, this is a reminder to all of us that as we engage in safely in the reopening of Saskatchewan, COVID is still around throughout Saskatchewan, and we need to keep taking all the precautions we have to prevent further transmission as our economy reopens. I'd also like to flag that the Saskatchewan Health Authority has also declared a community outbreak in Saskatoon. This involves a contact tracing investigation that involves more than 60 people and involves cases linked to 1 or more gatherings that were family gatherings that exceeded the public health, the way I understand it, as information received this morning, that exceeded the guidelines of gathering size not more than 10. In this outbreak investigation that's currently ongoing, 1 person has tested positive. There's 1 additional case who's presumptive positive. And while all indications at this point indicate that the situation is contained, that it was a closed private event, and that all close contacts are isolating at home, however, as multiple households were involved, a PSA, public service announcement, may be issued if thought appropriate by the Saskatchewan Health Authority. And again, these 2 events, the fact that there's 2 cases in Regina and now an outbreak in Saskatoon, again, is a reminder for us that even as we engage in reopening of Saskatchewan, even as we look forward on June 8th onwards, our indoor gathering size increasing to 15 and our outdoor gathering size going up to 30, we still need to consider very carefully who are we inviting. Is there another way of connecting with people, either virtually or by other means? And if we do choose to have any gathering of whatever size, are people who are attending vulnerable? What can we do to minimize the risk of transmission if, for example, someone was asymptomatic and attended? And of course, no one who has any symptoms should attend such events, even if it's within the prescribed limit, which currently is 10 and would go up to 15 for indoor gatherings on June 8th and 30 for outdoor gatherings. In terms of the total number of cases, we are at 637 now, out of which 68 are considered active. 10 more people have recovered, bringing the total provincial recoveries to 559. And there are currently 4 people in hospital. 1 person is receiving inpatient care in Regina, and 3 are in intensive care, all in Saskatoon. And to date, 44,118 COVID-19 tests have been performed in the province. Thank you.
Thank you, Dr. Shahab. We'll now go to questions. We'll take the first question from the line.
We have Morgan Majeski with CBC.
Hi there. So we've heard numerous reports of northern residents who have been denied medical appointments in southern areas of the province. One of them is actually former MP Regina, who says she was denied an appointment with an optometrist. Do you condemn those medical practitioners who are denying appointments to northern residents?
So I would, I'm not aware of these instances, so I will inquire in further details. Obviously, any Saskatchewan resident or anyone in Saskatchewan is able to seek or should be able to seek any necessary medical care. If someone is symptomatic, they should, of course, call ahead if they have COVID-19 symptoms. And care providers should have all the appropriate PPE to provide care in a safe manner and as required. Many primary care providers who now are opening up their practices do a risk assessment and screening before an appointment is made and on the day of the appointment as well to ensure that risk of transmission within a practice setting to either from patient to provider, provider to patient, or other people in the waiting room is minimized. But while I will inquire further, I will also ask Dr. Susan Shaw if she has any further information on this and any action that either the College of Physicians of Saskatchewan or other partners may be contemplating due to this situation.
Thank you, Dr. Shahab. I'm not aware of cases happening within the services provided by the Saskatchewan Health Authority. I have heard just through the media of reports of people who have had challenges accessing other aspects of medical care within the community. I agree that risk assessment at the point of arranging that appointment or right before the appointment, and then taking all of the best practices and precautions to ensure safety is the underlying principle, and that people should be able to access services regardless of location, as long as they're asymptomatic and the risks are managed. Absolutely, in an emergency or an urgent care situation, then we wouldn't want any barriers to exist for anybody.
Do you have a follow-up question, Morgan?
Yeah, I do. I'm hoping the province can kind of solidify the order of the 10 people who have died for us. We just want to make sure that we have the order correct, and in regards to, I guess, who has died is when. You know, Nelda Maurice was taken off of life support on Monday. Did these two new deaths occur before or after her death?
So I do not have any individual information that I can speak to. And what I can do provide is a summary of the deaths that were and the age ranges that I think has been provided yesterday as well by Dr. Worker. So as of today, the information I have is that there have been unfortunately 10 deaths in Saskatchewan, one in the 40 to 59 age group, five in the 60 to 79 age group, and four in the 80 plus age group. So overall, a total of 10 deaths. And but beyond that, I cannot confirm any specific identifying details, even if I had that level of detail.
We'll take our next question from the room. Stephanie?
Yeah, Doctor, can you provide a few more details around this community outbreak in Saskatoon? Like, was there one? When was this event held? You know, what kind of event was this that these 60 people went to? Was it like a wedding? Was this a conference? Was this, can you give us a bit more details on that one?
A couple of things. We have just received some preliminary information yesterday evening and this morning. And if there's anything that's relevant for the public, we will provide further information. All the information I have at this moment that there were family events, likely outdoors, likely involving a barbecue. But I think what I have promised is that if there's a transmission event such as this, or in the past when there's been a bomb spill, obviously public service announcement is always done if you can't contact everyone. In this case, our indication is that the local medical health officer who's leading the investigation has been able to contact everyone. But having said that, if there's a mass transmission event, or even when we see individual cases, as we learn about what were the exposure settings, we will continue to provide that feedback through these opportunities at press briefings. Because I think we all need to understand that nothing is risk-free, but at the same time, we need to engage in reopening. We need to re-engage socially, for the most part virtually, but also, you know, as what our current recommendation has been, gatherings limited to 10, ideally limited to a virtual household of 2 or more households, 2 or 3 households, or 2 or 3 friends. But I think what this underscores is that we cannot go back to business as usual. Even though summer is beckoning, even though we see more traffic on the roads, see more people outside in our green spaces enjoying the outdoors, which is very good. We still have to be very cautious that we still need to minimize transmission risk where we can. And we already know that getting together around food is a high risk. We have had large transmission events in the past before the gathering limits were reduced. And as we go forward to larger gathering sizes, which will be allowed 15 for indoor, 32 for outdoor, we need to constantly be aware of that. Why are we gathering? How can we minimize the risk for everyone, but also those who are higher risk? And as this investigation proceeds, we will provide, as much information as we can that informs all of us as we think about getting together with friends and family over the summer.
Follow up, Steph?
Yeah, now that the testing has expanded to people with no symptoms who are working outside their homes, is it encouraged for people who maybe don't have symptoms, who simply want to get a test, to go and do that?
So I think we will continue to evaluate the benefit of expanded testing. And as you know, Saskatchewan is not the only province who has expanded testing. All provinces saw a decrease in testing rates. Um, some provinces, they were not as concerned, like in Saskatchewan, we were not that concerned because our overall numbers are very low also. But at the same time, we do want to see some level of testing happening throughout Saskatchewan. We will be analyzing and reporting on those test results, not just in terms of how many are positive, but why did people choose to get a test? Were they symptomatic? So we already know that so far most of the people who got tested were symptomatic. But in case we see people who had absolutely no symptoms and decide to get a test, we will continue to analyze that, report that back, that what's the additional value of that. And of course, testing is done in asymptomatic people when there's an outbreak in a closed facility, like a long-term care facility, when there's a case contact investigation in a healthcare facility, or when there's, as part of the outbreak, for example, in Northwest Saskatchewan and Alosh, as contacts are followed up and isolated, where appropriate testing was done in people who may have had no symptoms at that time and later on developed symptoms. So I think we need to continuously analyze what we are doing, what is the benefit of that, what are some of the risks. There can always be risks also in terms of we have to understand that if you are test negative, that tells you nothing about tomorrow. So if you were a close contact or have some concerns and get tested, you still have to watch your symptoms. If your symptoms get worse, or you were a close contact, you still have to monitor yourself for 2 weeks, stay in isolation, or as otherwise directed by public health. So we still need to understand that, analyze that, and report back to the public in terms of the value, in this case, of expanded testing. And of course, there's specific populations like people who may be starting chemotherapy, which again needs to be analyzed. What is the value of testing people who are starting chemotherapy in parts of the province where right now COVID transmission is very low but not zero? So if you find some people who were COVID positive, and as a result of that, additional precautions taken before starting chemotherapy, or chemotherapy was delayed for a couple of weeks because of that, that'll be useful to know. If you find that when transmission is below a certain threshold, you find hardly any positives through expanded testing, that's also good to know for future reference. What is the threshold over which you start finding more people? I think that is the kind of detailed analysis we'll have to continue doing. Like in the past, our detailed analysis showed, like in March, that most of the people who presented for testing, test positivity rate was fairly low, 1 to 3%, more likely to be higher if you had recently traveled from other parts of the world or were a close household contact. So as our situation has evolved and will continue to evolve, that's the kind of analysis we'll have to continue to do, and that also provide back, because that then informs all the actions we need to take as individuals in Saskatchewan.
We'll take our next question on the line.
We have Mark Smith with CTV.
Hi, were either of the two people that have died or were announced as deaths, say, from COVID-19, were they admitted to hospital prior to dying? And if so, for how long were they in hospital battling with the virus?
So I do not have this level of detail at this time. I can, however, provide you a cumulative summary of people who are hospitalized. And the reason I'm doing that is that I think instead of focusing on individual instances, we need to understand the whole epidemiology of COVID-19 in Saskatchewan and understand, is it different or similar to what's happening throughout Canada or the rest of the world. So if we look at our total case numbers as of today, we are at 637 reported cases. out of which 68 are considered active and 559 have recovered. If you look at our total deaths, unfortunately, a very tragic outcome, there are 10. And even though each death is unfortunate and tragic, if you look at the age ranges, our deaths were in the expected age ranges 1, 40 to 59, 5, 60 to 79, and 4 so far 80 and older. And we have to remember that we have been very fortunate in Saskatchewan, primarily due to all the steps taken, all the diligence observed by family and friends about not visiting people in long-term care unless essential or compassionate reasons, all the steps taken by the Saskatchewan Health Authority about staff cohorting, screening, temperature checks, that our death rate in 80 plus is at this time lower because we have not seen the devastating outbreaks that many of our fellow provinces have seen in long-term care facilities. So that is the deaths. If you look at our total cumulative hospitalizations, and we need to understand that as well, that we've had 44 hospitalizations in either hospital or ICU, and the age ranges for hospitalizations, and we will get further detail on how long were people hospitalized, but hospitalizations have occurred in every age group. But we have had only one in 0 to 19, one in 20 to 29, one in 30 to, 2 in 30 to 39, so 4 in under 40, but no deaths. We have had 11 hospitalizations in 40 to 49, 11. So the highest hospitalizations have been in that 40 to 49 age group. This also corresponds to the fact that our case numbers have been higher in that young adult, middle-aged adult age group, and that's likely because they are more likely to be working in essential services, more likely to be out and about. So we cannot forget the fact that we can't just think that COVID is something that has serious implications only if you're older. Then we've had 6 hospitalizations in 50 to 59, 8 in 60 to 69, 8 in 70 to 79, and 7 in 80 plus. So again, this gives you a kind of a picture of we've had hospitalizations in all age groups, but certainly the bulk have been 40 and older. And finally, if you look out of these 44 hospitalizations, 15 have required ICU care, and that definitely is more likely to be required if you're older. So 3 people required ICU care in 40 to 49. So out of the 11 hospitalizations, only 3 required ICU care, but still a significant proportion of people who are otherwise middle-aged requiring ICU care, and then 1 death out of that age group, and then 3 requiring ICU care, 50 to 59, 5 60 to 69, 4 70 to 79. So in summary, there's nothing that stands out in terms of COVID-19 behaving differently in Saskatchewan than other provinces, but we have to also recognize that in general we may have populations with a higher incidence or prevalence of chronic underlying risk factors like heart disease, diabetes, chronic lung disease. Smokers seem to have a higher risk. So all of us need to be aware of this risk in ourselves in terms of what precautions we need to take against COVID-19, when to seek urgent medical care. And then as we expand our virtual households, we need to be conscious of who are we inviting, what are the age ranges, do they have any underlying risk factors, are we having an honest conversation if we are making a virtual household or having a small gathering, that is this a risk that is worth for all of us taking, or should we protect some, either by ensuring physical distancing or taking other steps. And this is the kind of information which I will endeavor to keep bringing back in terms of informing all of us about how to minimize our risk while also connecting socially in a safe manner, while also engaging in the reopening of Saskatchewan.
Do you have a follow-up question, Mark?
Yes. You mentioned all the contacts dealing with the Saskatoon outbreak have been reached. How many people have been contacted in regards to that outbreak?
So this is just preliminary information from this morning. We will provide further summary information in a day or two.
We'll take our next question on the line.
We have Lynn Giesbrecht from the Leader Post.
This morning, the NDP was raising concerns that a lot of the ER hospitals and emergency departments that were closed have been experiencing staffing shortages for years. If those hospitals are suddenly needed for COVID-19, is there actually going to be the staffing capacity to use them?
We'll ask Scott to answer that question.
Sure. So it's a good question. So with respect to the news release, which talks about some of the history behind these facilities with respect to temporary outages of services because of staffing concerns, I mean, that's one of the things that we'll be looking at as we reopen services in all of these facilities is what does the staffing mix look like when we have the cohort staff? And as you've already pointed out, we will be training the staff to look at caring for COVID patients, which originally was not part of the plan. There would have been 12 COVID-free facilities. So the other thing to keep in mind is if we do see larger outbreaks in rural Saskatchewan, one of the things that we will be doing is focusing resources in larger centers to ensure that we can provide consistent care. So as we reopen these facilities and make sure that they're safe for both staff and residents of long-term care, as well as patients coming into the facilities, we'll also be looking at what's happening with COVID to ensure that our resources are put in the right places to respond to that surge. Right now, as you know, and one of the reasons for the moving the plan forward and reopening or reestablishing the services in these facilities is because what we've seen with COVID across the province, particularly over the last couple of weeks, where we see a low number of cases and that being maintained. And then if we continue to see that, we're not overly concerned about the day-to-day service for COVID patients. What we'll be concerned about is ensuring that we can keep all of the staff safe and working in these facilities so that we can have a continuity of service.
Do you have a follow-up question, Lynn?
Yeah, like if the hospitals there don't have the staff they need to really be open now, even as it is, would you have to move staff from larger centers to these rural places then? And like, how would that work?
Well, in most cases, these facilities all have the staff to be open. That's why with the temporary wind down of services, particularly in ER, you know, the vast majority of the facilities, I believe, at least 9, if not 10 out of the 12 were functioning with ER services. 2 were not, because those were 2 areas of the province, Broadview and Radville, where we have disruptions of service because of either physician staffing or others. And it's important to know that it's not just around physician staffing, it's around those other experts, lab and diagnostic imaging technologists, as well as nursing staff. So those facilities are staffed, but as we cohort the staff into those facilities, we'll be looking at making sure that they can be operating safely. They're not, you know, they were open before, so assuming that the staff stays stable over the summer months, we shouldn't see a break in services for those other facilities. We should see those facilities open up and providing care as they were before.
We'll take our next question on the line.
We have Adriana Christensen with CJME.
Hello. Yes. So now that it's been a few days since testing was expanded, how busy has it been? Are many more people coming forward? And kind of in a two-pronged question, when we now see cases in a region that hasn't had any for a while, like the South and Regina area, is that linked to higher testing, or is that from a different kind of instance?
So maybe I'll give some initial remarks and then I'll see if Scott has any further information. So I think it's early days yet, and I think some day-to-day fluctuation, we can't read too much into that. So I think we'll have to give it some additional days to see is the trend going up, and is it going up throughout Saskatchewan, as well as, like you've mentioned, parts of the province where there have been no cases, because we do want anyone living anywhere in Saskatchewan to obviously get tested if they have any symptoms, but also be able to get tested if they have any additional concerns and want to get tested. So we'll have to analyze that and look at it as a testing rate per population throughout Saskatchewan. And yes, if we see any additional cases who present in people who may have had symptoms that are so mild that ordinarily they would not have thought of getting tested, that is the whole purpose, that as we reopen our economy, we want to see these mild, possibly asymptomatic cases, because that does inform us in terms of, are we proceeding on the right track with these additional testing? Are we still seeing low numbers, or are numbers creeping up? And the interview that happens as part of the case content investigation, that's very valuable, because that asks questions about, did you travel out of the province? Do you work outside the home? What kind of activities are you involved in? And we need to analyze that in terms of, are some of the new cases as we move forward linked to particular activities that are now allowed? Because that will provide us to give feedback to those sectors where there may be transmission, and maybe even fine tune our recommendations or requirements for safely proceeding with reopening. But I think at this point, for me at least, it's too early to give any definitive trend analysis, but I'll see if Scott has any further information at this point.
So I just reiterate that what Dr. Shahab said. I think it's too early to say that there's a definite trend, but I do know that over the last few days we have seen an uptick of calls and referrals to 811, and we are seeing folks being tested in the new categories of testing. So that includes sort of those people working outside the home, healthcare workers and the immunocompromised patients, and people who are immunocompromised. The other thing to remember is, our testing strategy, as Dr. Shahab has talked about very often, has served us very well throughout our response to the pandemic, including we have a very low test positivity rate for those folks that we've had with symptoms, contacts, both in long-term care and direct to those cases. We haven't been tracking data that we would be able to say this is how many people showed up that were asymptomatic that tested positive yet, because we simply don't have enough data. And we haven't been tracking that because we've been focusing on folks with symptoms or through outbreak management, either close contacts or contacts. And then, of course, there's some of those specialized testing situations where we went up into the wash and went door to door. So I think we're going to see more growth in that trend over the weeks to come. But right now, I think it's just too early to tell. But we are seeing an uptake at 811. But it's also more important for folks to know that it's not just 811 through referrals. It's also contacting your family physician or nurse practitioner that can help support sending folks on for referral for testing.
Do you have a follow-up question, Adriana?
Yes, I guess this is kind of linked to the outbreak terminology. So when you describe what's happening in Saskatoon, with one positive case, I believe you said, and one presumptive, I guess why would you describe that as an outbreak, or is that in fact just an outbreak investigation, I guess?
I think we do get tied up in some of the semantics, but I think at the end of the day, all these investigations are of value if they let us be better informed going forward. And that's the whole point. And certainly, we have a very low threshold for long-term care facilities. A single case in a resident or staff is declared as an outbreak because it's important for the public and for people whose loved ones are in that facility to know that there's a single case and additional precautions and measures are being taken place. Beyond that, a single case in a hospital which requires a case content investigation may or may not be announced publicly just for transparency, because it's a public sector facility and there may be people coming in and going who may think that they need to know if there's case content investigation, but usually those are well contained. But we also have to remember that whenever we see, and this is not limited to COVID-19, it's limited to all kinds of investigations that public health does related to communicable diseases, E. coli, measles, mumps, that when we are confident that we can track everyone limited to a communicable disease, there's generally not a requirement to give a public statement. But when you can't track, there's a public service announcement. But we always, when we investigate a single case or cluster of any notified disease, or in this case COVID-19, and we learn something new, we do share that with the public, that listen, we have seen transmission happening in these settings, and this is why we need to be extra careful around. For example, in the past, we've seen transmission happening when people are crowded indoors or when there's food involved. So whenever we learn something new that's of value as part of the investigation, it is important to share that publicly, because then that can guide all of our actions in terms of what can we do to minimize our risk going forward.
We'll take our next question on the line.
We have Roberta Bell with Global.
My question is in regards to the new cases in Regina. I was just wondering if you could confirm whether or not they're linked to a specific event, or if they're even in the same household, contacts related to the same instance, or if it's travel related.
So I do not have that detailed information at this point, but as we get information about potential exposures that we can identify, we will be sharing that. And I think we need to remember two things. One is that, and we've been saying that ever since middle of March, once you start seeing community transmission with no obvious exposure, that is important in its own right. Because once you start seeing people who are not traveled, who have not been a close contact of a case, we knew that COVID-19 transmission was happening in Saskatchewan. So if we find no exposure, possible exposure after an exhaustive interview that can take, more than one day, that's also important to know because it just informs all of us that there is ongoing low level of risk in Saskatchewan, and that's why we all need to physically distant when we go out and about our work, whether it's shopping or other work or even recreation. But then if we see specific exposure histories, we also need to share that. So most cases are, you are right, contacts of a known case. But if we start seeing trends related to particular activity, we will be sharing that as well. But at this point, I do not have any specific information regarding the cases in Regina. And going forward, we'll have to see just one or two exposure events don't necessarily mean that a sector is maybe more risky than another sector. But over time, as we get better data and larger numbers, we certainly need to analyze that and share that back in terms of where do you need to be especially careful in terms of engaging in some of the allowed activities going forwards.
Do you have a follow-up, Roberta?
Just on an unrelated note, with the 2 deaths, I was just wondering if you could explain how some deaths can take multiple days to record, whereas other ones, you're reporting them like the next day after it happened the night before. Can you just explain why some take multiple days and some we can report right away?
So in the past, what has happened is that if there has been a death linked to a hospitalization or ICU admission, that usually that record of hospitalization or ICU admission is already in the system. We have in the past always made sure that family and next of kin were informed before any public reporting. And then because we now rely on, and we want to rely more on our database, they will, going forwards, as the case numbers increase, there will be a 1 to 2 day lag. But at least then in that case, we will have reliable information. And I know it is challenging for all of us when there's a bit of a lag, but we do need to, I think, adhere to this process so that we don't, even though sometimes, there's information that's available through social media or other means, we do need to follow a consistent process just to be accurate in terms of what we are reporting. And that's why sometimes that whole investigation, confirmation that the death was associated, if not caused by COVID-19, and other details have been confirmed and verified by public health before we can report.
We'll take our last question in the room here. Steph?
Yeah. Doctor, how come the new positive case out of Saskatoon isn't counted in the 3 new cases that have been announced today?
So my understanding is that, and I'll confirm with you by confirming that this may have been reported earlier, but it's not a matter of not being counted as of today. But I'll have to get that. I'll have to confirm those details.
Follow up, Steph?
Yeah, given the fact that we've seen some transmission associated around food, like I'm thinking the Christopher Lake rally, the Bonspiel buffet that happened at Edmonton, now this community outbreak in Saskatoon that could be related to a barbecue or something, like, why are you not saying people avoid having barbecues with your friends and families right now, if that seems to be like a high-risk trend when it comes to spreading COVID-19?
Yeah, so so obviously one thing that we've been reassured is that food itself is very safe, and we have seen no signals of concern. So, for example, from people actually accessing food from restaurants and takeout. So I think that's the good news. I think the concern is, and it is always hard to pinpoint what the exposure is, but it seems to be when people get together, either indoors or outdoors, and they're closer than 2 meters, whether it's a barbecue or other social gathering, transmission happens, and we can understand why that happens. Transmission is droplet through coughing, sneezing, or talking, or singing, or crying and hugging. And whenever there are opportunities where people get closer than 2 meters, whether it's around food or whether it's around celebrations, or unfortunately when it's around grieving or other cultural or religious ceremonies, transmission has happened throughout the world, throughout North America, throughout Canada. And so first of all, we need to understand that, and then whenever we have opportunities to gather as allowed, we just need to be mindful of even though we're getting together as our virtual household or as friends or as part of an event, what can we do that's different from how we used to gather before? And I think that's the main message that maybe, obviously, no one, I hope at least shakes hands or hugs anymore. And I think but some things happen almost instinctively. And for meals, sometimes the recommendation is that where you can provide pre-made, lunch plates or lunch boxes, that's a better idea instead of everyone serving themselves from a buffet. And as restaurants open, for example, buffets will not be allowed. But of course, if people are having private gatherings, sometimes, thinking through those things, looking at the guidelines for restaurants and say how you can provide a safer experience to your virtual household or to small group of friends. I think that's what all of us need to think through as we navigate the future.
Okay, thanks everyone. That concludes today's conference.